Schizophrenia is a chronic and severe mental disorder. It affects how a person thinks, feels, and behaves. Individuals with schizophrenia may seem like they have lost touch with reality. This can be distressing for them and their loved ones. Schizophrenia is characterized by a range of symptoms. These symptoms can vary from person to person. They can also fluctuate over time. Understanding this complex disorder is the first step towards effective treatment and improved quality of life for those affected. The exact causes of schizophrenia remain a mystery. However, research suggests that a combination of genetic and environmental factors plays a significant role. Genes make some individuals more vulnerable to developing schizophrenia. Environmental factors can then trigger the onset of the disorder. These triggers may include exposure to viruses or infections during pregnancy or early childhood, complications during birth, such as oxygen deprivation, early childhood trauma or abuse, and substance abuse, particularly cannabis use during adolescence. It's important to note that not everyone exposed to these factors will develop schizophrenia. The interplay of genes and environment is complex and not fully understood. Schizophrenia affects the structure and function of the brain. Neuroimaging studies have revealed differences in brain regions involved in thinking, planning, and emotions. These differences include enlarged ventricles, which are fluid-filled spaces in the brain that are larger in individuals with schizophrenia, reduced gray matter, the brain tissue responsible for processing information, and abnormal activity in the prefrontal cortex, the part of the brain involved in decision-making and working memory. These structural and functional abnormalities disrupt the brain's intricate communication pathways. This disruption contributes to the characteristic symptoms of schizophrenia. Section 4. Diagnosis: Unveiling the Invisible. Diagnosing schizophrenia is a multifaceted process. There is no single test to confirm the diagnosis. Instead, doctors rely on a comprehensive assessment that includes psychiatric evaluation, a detailed interview, to gather information about the individual's symptoms, medical history, and family history of mental illness. Mental status examination, an assessment of the individual's current mental state, including their appearance, behavior, mood, and thought processes. Physical examination, to rule out any underlying medical conditions that may be contributing to the symptoms. The doctor will also consider the individual's cultural background. This is important because cultural factors can influence the expression and interpretation of symptoms. Section 5. Laboratory parameters supporting the diagnosis. While there are no specific lab tests to diagnose schizophrenia, certain tests can help rule out other conditions. These tests may include blood tests to check for thyroid disorders, infections, or drug use, urine tests to screen for drug use, brain imaging scans such as MRI or CT scans to rule out brain tumors or other structural abnormalities. It's important to remember that these tests are not diagnostic of schizophrenia. They simply provide additional information to support the clinical diagnosis. Section 6. Treatment and management. A multifaceted approach. Treatment for schizophrenia typically involves a combination of medication and psychosocial interventions. Antipsychotic medications. These medications are the cornerstone of schizophrenia treatment. They help reduce the severity of psychotic symptoms, such as hallucinations and delusions. Psychosocial therapy. Different types of therapy can help individuals with schizophrenia manage their symptoms, improve their coping skills, and enhance their quality of life. These therapies include individual therapy, to address personal challenges and develop coping strategies. Family therapy, to improve communication and support within the family. Social skills training, to enhance social interactions and daily living skills. Treatment for schizophrenia is often lifelong. However, With appropriate treatment and support, individuals with schizophrenia can live meaningful and fulfilling lives.